Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk again about obesity and these new medications that we have to treat it, which to me are the most important medical discovery of the 21st century. You know, obesity is a controversial thing with a lot of people. And really, one of the articles I read in the journal last week prompted me to talk about this because it's very important. Obesity is a disease. This is beyond you if you have this metabolic syndrome of obesity. You don't have control over it. That's why so many people fail with diets. And there is no such thing as willpower in the end. You have a metabolic problem that now we have these life-saving medications, not for everybody, but for the majority, yes. I'm talking about the GLP-1s and GIPs. I prefer the combination. You know, bias and stigmatization of obesity directed towards obese people contributes to poor health and really impairs treatment. Weight discrimination is nearly as common as racial discrimination. And it's really worse for women than it is for men. What we call fat activists, or at least what the journal calls them, fat activists. And those are people that have a problem with the way obese people are viewed. And they push back against the idea that obese people have a disease. They promote fat acceptance. The AMA, the American Medical Association, declared obesity a disease in 2013, and I believe it is a disease. And now that there's these amazing breakthrough medications for this, we need to use them. I'm talking about the GLP-1 GIPs. So these fat activists want to disregard them and view them as dangerous and shift the focus from changing their bodies to helping them live in them and accept it, which has its pros and cons. But again, we're trying to help these people overcome a disease, and we've got these amazing ways to do it. I mean, if you look at some of the ads and some of the people that are promoting the GLP-GIPs, I mean, these are a lot of famous people. Oprah Winfrey realized that Weight Watchers didn't work. Now Weight Watchers has turned into kind of an Ozempic feast, which, you know, is the right way to start viewing this. And we're learning more and more, and there's going to be even better drugs out in the future for this. But for right now, we've got some amazing tools to help you. Like I say, they're not for everybody, and you need a doctor who knows what they're doing. And again, you need to change your habits as well for the other health parameters, but they're very useful. So, certain facts are indisputable. Over the last 60 years, obesity rates in the United States have tripled. 4 in 10 adults have a BMI of over 30, which is classified as obese. And the financial costs are very significant. Obesity causes an estimated $385 billion in healthcare spending in 2024, last year. JAMA reports that employees with obesity have 7 times the medical claims and 11 times the indemnity, meaning insurance cost, than non-obese people, than healthy weight. They file twice as many workman compensation claims. In Europe, obesity is actually classified as a disability. There's no doubt that obesity is linked to a wide range of diseases like type 2 diabetes, heart disease, certain cancers, osteoarthritis, non-alcoholic fatty liver disease, asthma, hypertension, venous thromboembolism, blood clots. Remember, fat cells cause inflammation, which is really at the root cause of all diseases, including cancer. There's no doubt that when an obese patient comes into the room with a doctor room, I've experienced this many times, with another reason for coming in, say a sprained ankle, there's always an elephant in the room. Should you address really the main problem they have, their obesity? Some get offended. You have to know how to do this, but if you're a good doctor or practitioner, you really need to address this with your patients. Honesty is the best way to deal with anything that comes into your office. But it's hard sometimes. And now we have a great way to treat them. In the past, we had ways to treat them, but nothing that approaches what we have now with these GLPs. And I'll tell you, it's very hard to deal with sometimes. It's not easy as a physician to get off on this, especially if you're a regular physician in a large practice. When you have 7 minutes to spend with a patient and they come in with a sprained ankle, you're not going to take it up. But if you practice in the right way, you're going to take it up. You know, it just kills me when doctors say, you have one problem today, that's all I'm going to address, when there's an elephant in the room and there's other problems that need to be addressed. Take your time with patients. You know, they're paying you, they deserve treatment. So it's tough. Can it be your most dangerous health problem? Yes, I think it is. When I founded my practice, it was really 18 years ago to treat obesity. That was the main reason I founded performance medicine, because I was putting these obese people on so many different medications for their diabetes, their hypertension, their depression, their arthritis, their hyperlipidemia, when the main problem was they're obese. All these other problems disappear when you treat the obesity. And these people were on multiple medications. They felt no better. They were still obese and miserable. So you need to learn how to address it. And that's one of the main things that I've done in my practice. It's very gratifying. So we don't just need to treat the comorbid conditions. We need to get to the root cause of the problem, obesity. And you know, I'm sure it's irritating for obese patients to be viewed this way. But remember, a doctor is there to help you, not try to avoid hurting your feelings. And really, when I tell an obese patient that we finally are understanding that this is a disease and not a personality fault, they're relieved. True, we haven't really understood obesity in the past very well because it's multifactorial. You know, it's hard to get long-term solutions until now. And you have to realize these GLP-1s are maintenance medications. They're not lose 30 pounds, 50 pounds, and then stop it. You stop it, you're going to gain the weight back. The goal for my patients are to work your way down to a microdose, but stay on it. We still don't have all the answers, but now, due to these mind-blowing results we're seeing with these GLP-1s, we're making some amazing headway. Like I said, to me, they're the most important drug discovery of the 21st century. I mean, it ranks right up there with insulin discovery in 1922. I have 2 diabetic kids that need insulin for their lives. So, and remember when penicillin was discovered? This is groundbreaking stuff. There's always going to be skepticism. And true, there can be side effects in a very small minority of patients. We can work with these. And then that's why that's why we start out low and go higher. And I'll warn patients that they have a lot of problems, they need to call us and we'll work it out. Some can't take it. People have had recurrent pancreatitis or medullary cancer of the thyroid, which I've never seen a case in 40 years. And about 10% of patients don't respond to GLP-1s. Then we try other things, including the combination drugs. And pretty soon we're going to have a triple G drug that will be FDA approved that we can use. With any drug, you have to weigh the risk versus the benefits and the side effects. And you need to learn to eat, sleep, exercise, and evaluate your hormones as well. It's all inclusive. So they are maintenance medications. And you stay on them just like you would if you had an inherited essential hypertension, blood pressure problem. So we don't want discrimination in any form, just treatment of a disease that has major consequences. Remember, obesity in any category is going to shorten your life. Up to 13 years for severe obesity. And it's going to create a lot of misery along the way. And again, you can be discriminated against. There is a solution. Why not see a doctor who can treat this? At Performance Medicine, we definitely can. I hope this helps clear up some things. I'll see you next week.